Welcome. Welcome to the October 3rd meeting of the Council on Aging. It is now called to order at, look at that, right on 1 o'clock. We will now have the Pledge of Allegiance led by Commissioner Fotheringham. Please stand.
Okay. Turn on your mics.
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Nick. We will now have the roll by our staff liaison, Francine Spriggle.
When your name is called, please indicate by saying here or present. Commissioner Fotheringham?
Here.
Commissioner Grimm?
Present.
Commissioner Healy?
Here.
Commissioner Kopass?
Here.
Commissioner Loomis?
Present.
Commissioner Norkin?
Here.
Commissioner Shentez?
Yeah.
Commissioner Searden?
Here.
And Commissioner Wing?
Here.
Thank you.
Well, we breezed right by the first 3 items. Let's move on to 4. It's going to be a busy day, folks, so fasten your seat belts. Item 4 on the agenda is a time in our meeting when we invite members of the public to state their concerns about senior-related issues in our city, present items for commissioners' consideration, and/or make announcement. We have 2 speakers today. First, we'll bring up Frank Fabriga. Frank, I know I butchered it. I'm sorry. Please introduce yourself, Frank. Thank you. The mic was off, Mike. Frank, I'm sorry.
Frank Fabrega. I'm a volunteer with the American Cancer Society. Today I'm here to speak a little bit about Relay for Life of Thousand Oaks. Our event is scheduled for May 18th and 19th, 2013. It'll be held at the Cornejo Creek Park South, as we've held it in the past. Last year we had over 900 participants attend our event. Those are residents from the Thousand Oaks and Newberry Park area. We had over 200 cancer survivors attend with their caregivers. And this year we're holding our event, and we're looking for those that are interested. They can contact our website at www.relayforlife.org/ThousandOaksCA. We are looking for team members, participants, cancer survivors, and their caregivers. Thank you.
What were the dates again on that?
May 18th, 2013, and May 19th, 2013.
Okay, very good. Well, I hope to see you again then, Frank. I'd love to have you come and publicize it again later on.
Thank you very much.
Sure thing. Our next speaker is another longtime friend of Council on Aging, Carol Freeman.
Thanks for the opportunity. I'm Carol Freeman, and I'm a member of the health team from Council on Aging. And I'm here today to talk about a seminar we have coming up out of the health team. Most people know their blood pressure. Many even know their cholesterol level. Most of us know and regret our weight. However, most people do not know their T-score. And no, it has nothing to do with golf, for those of you thinking of that. T-score is related to the potential diagnosis of osteoporosis. It's used as an indicator, and it's something that affects all of us. So if men, you just turned off your ears, listen up. Osteoporosis is not a female disease. It is both males and females. So on November 13 at the Thousand Oaks Library, starting at 6:30 p.m., and I have some flyers here that I will leave behind. Starting at 6:30 p.m., we will be doing a presentation seminar on osteoporosis, and it is called Fit to a T. And Dr. Cheryl Lambing from our Ventura County Healthcare Agency will be the presenter. So if you want more information, contact Council on Aging. It will be on their website here very shortly, or pick up a flyer on your way out. Thank you. Questions?
Any questions, thoughts? No, thank you for putting this one together,
Thanks.
Carol. Another
You're
one. Yeah, Carol just can't get away from the health industry for some reason, but we're sure glad she does. Are there any other public comments? If not, we'll close item 4 and move on to item 5, guest speakers, and I'll turn this over to Jim Searden.
Thank you, David. Our first speaker is Andrea Gallagher, an excellent friend of the council and an absolute blessing to our community. Andrea is a certified senior advisor. She is the national president of the Life Planning Network and is the president of Senior Concerns. Andrea, I know you have some excellent news for us, so let her rip.
Sorry. Should I go again? Yeah. Okay. You know, something just happened yesterday. I was talking to my husband, and I was talking about what was going to happen here today, and I said, you know you're getting older when you're going to give a history lesson on your own generation, the boomer generation. So I'm going to talk a little bit about them today. But more importantly, I'm here to voice a rallying cry that hopefully we can create a movement as an organization, as a generation. Just like JFK did when he called to action our country, let us do things for the country versus expecting things from them, or MLK, who had us rally around a dream. So really, it was 1963. I want to make sure. There we go. Are my screens? There we go. Okay, there we go. Great. Okay. It was 1963, and Bob Dylan had written a song, "These Times They Are A-Changin'." It was a time when 70 million baby boomers from the post-World War group came back, were teenagers or adults. And as boomers, they went through what I'll call the wonder years, Wonder Bread. And everything and everybody seemed to adapt to them. Mom and Dad moved to larger homes in the suburbs so the kids could have their own bedroom or have some privacy. Communities built schools and pools and shopping centers and malls, providing them with places to learn and play and shop. Restaurants actually at that first time created children's menus, and colleges started new programs and subject areas to appeal to baby boomers. But now, as young adults, boomers weren't content with the way things were with the generation before them. The America where they'd spent their first 20 years growing up was pretty much a closed society. Women rarely worked outside the home, and they didn't have equal rights. For example, if you were married and you were a woman and you wanted a credit card, chances are probably you weren't able to get one in your own name. Blacks and other minorities were second-class citizens. There wasn't much concern for the environment, and corporations ran roughshod over employees. But as boomers came of age, they began to revolt against the conservative norms of the times. You may remember the hippie counterculture, and that really sparked a social revolution towards a more liberated society. The sexual revolution, questioning authority in the government, demanding more freedoms and rights for women and minorities. As these 78 million strong boomers rallied, change became inevitable. It was termed the Me Decade, with a focus on individualism. You may remember that term, WIFM, what's in it for me? It became the mantra. There's a lot of me products that were created. The VCR to tape my shows, the microwave oven to cook my meal, and the pocket calculator came on the market. We celebrated the first Earth Day, and our values changed. Watergate scandal broke, and we began to mistrust government, and it became okay to get divorced. But change didn't stop there. Over the last 40 years, so much has changed, in large part to boomers. They may not have led all the changes, but they've been the legions of followers that have made change permanent. With all the constant attention and focus on them as children, boomers came to see themselves as large and in charge. They could use their numbers and their might to bend any industry or institution. Think of Pampers, came out when baby boomers were children. L'Oreal skincare, never even created before that. And Just for Men hair dye. Boomers have transformed work in America, thanks in large part to the fact that they were the most educated generation thus far and because of their numbers. They're now moving to encore careers in droves and embracing the notion that the American dream is measured in spiritual, not material fulfillment. Boomers paint a picture of the future that is rose-colored. They always see the glass half full. I'm never going to get old. I'm never going to die. Pass the latte, please. And boomers refuse to accept the way things are, and they expect to change them, presumably for the better. But the world is now changing at a faster pace than any of us had ever anticipated. Long-trusted programs like pensions and Medicare are changing the way we must financially prepare for our future. There's new definitions of work, new jobs that require years of training and special skills. Our parents are now living into their 80s and 90s, reluctantly relying on us to care for them, both physically and financially. And we're getting older, dealing with our own health conditions and health costs that are rising exponentially. So here's this fella, and he's looking, he says, what am I supposed to do about all of this? There's a dizzying array of choices to be made in a really complex, fast-changing world. So what are most boomers doing? Well, I'll tell you what they're doing. Unfortunately, nothing. A very small amount of boomers are thinking about their future, 17% in fact, when polled. And that 17%, what they say is that they have they've achieved a 10 times greater chance at self-proclaimed success than the folks that didn't do any planning. So there's too few folks that are doing any kind of planning at all. And if we've learned anything as we've reached age 50 and beyond, it's that our future is up to us. Our experiences in the second half of life are going to be largely made up of what we plan for and what we don't plan for. So there's a lot of opportunity to live fully and happily and with confidence into our 80s and 90s and 100s. We see it all the time. But it takes two things. It takes an awareness of the future, and it takes some planning. So to help boomers look forward to the next 30 years, Senior Concerns and the Council on Aging are producing Boomer Boot Camp. It's a 3-part distinguished speaker series here at the Sheriff Forum Theater on 3 consecutive Wednesdays, October 10th, 17th, and 24th. I call the program edutainment, education and entertainment. Pretty much that and a little alcohol, the only things that'll get boomers to move. So on October 10th, we actually have Richard Adler from the Institute for the Future. I've actually listened to Richard speak many, many times. He's actually a tremendously brilliant and personable man. He's going to take us on a tour of the future, sharing how boomers will profoundly shape their experience of aging, how we'll use technology to expand our capacity as we get older, the new networks of support that we'll have, and changes that will occur with housing and transportation and health care. So if you think you know what your future is going to look like, come to this program. I guarantee you have no idea of the changes that are out there. On October 17th, we have Helen Dennis. She's an author and a national leader on aging and retirement. And she's going to show us how successful aging is not a roll of the genetic dice, that she'll share what science teaches us about slowing the aging process and the role of activity and engagement and purpose in growing old. And the last in this series is Steve Vernon. Steve's a CBS columnist, and he's actually a consulting actuary. Now, truly, that sounds like a big snoozer to me, except for the fact, because I know my husband's a finance guy, I can say that. But he has a wonderful way of communicating stories. So he's going to teach us about what Mr. Spock and Homer Simpson and Clark Gable and your dog and a marshmallow have to teach us about planning a secure retirement. So here's your chance to be empowered and inspired, to think about your future in a new way. Senior Concerns and Council on Aging wanted to make this program very affordable. This series is $55, a couple dollars more if you get it at the ticket office because they have a little handling fee. A little over $18 for each event, less than the price of a movie and a snack for 2, an entertainment that just might pay dividends for years to come. I have tickets today. You can get tickets at Senior Concerns. You can get tickets at the box office. And the wonderful thing about this event on top of it is that the proceeds will support Senior Concerns Meals on Wheels program. So here's my rallying cry. It's not nearly as good as I Have a Dream, although I do have a dream. And I have a dream that baby boomers are going to change the face of aging for the positive. Thank you.
Are there any questions of Andrea? Andrea, that was fantastic. Thank you very much. We're looking forward to that event. Most of you all know that we have some pretty amazing, incredible things about to happen here in Thousand Oaks, and one of them is the opening of our new health facility. And to tell us all about that, Dr. Robert Gonzalez is going to join us. Now, Dr. Gonzalez graduated from UCLA, went through that system, and was trained and is board certified in internal medicine and rheumatology. And after about 10 years of private practice, he joined the Ventura County Health System and is now the director of the Ventura County Healthcare Agency. Welcome, Dr. Bob. Delighted to have you. Tell us what's up.
Thank you so much, and thank you for the invitation to come back and fill you in a little bit on the progress that's occurred over the past several months. What I'm going to do is walk through just a little bit of an introduction into our overall medical services with the healthcare agency, and then we'll focus a bit more on our Conejo project. And our mission is, of course, to serve the public as one of your county government's agencies and provide comprehensive and cost-effective care. We hope to do that in a compassionate way that really takes into account the needs of all of the residents of Ventura County, irrespective of their socioeconomic status or insurance status. Our vision, of course, is to set the standard, a high standard for healthcare excellence. And our desire, of course, is to see, as time evolves, other efforts that we're making to try to make Ventura County a healthier community, because I think we've all learned that when you try to prevent illness, that it's a lot less costly, both in terms of dollars and human suffering. The Ventura County Healthcare Agency includes two hospitals, Ventura County Medical Center, which is in the city of Ventura, and the Santa Paula Hospital, which is in Santa Paula. And between the two, we're able to provide comprehensive medical services. We have ambulatory care sites, and the Conejo Clinic is an example of one of those, but we actually have got now 14 primary care clinics distributed through the county, and about another 20 clinics now that are in specialty care. And the healthcare agency, besides the hospitals and the medical clinics, includes the behavioral health department, which has over 20 sites, and our public health department. We also have our own health plan, which is an HMO that's offered to county employees, and we run certain state programs through that, and also the medical examiner's office. This map depicts the locations, and I think there's a lot of detail on here, but the bottom line is, if you were to add up all of our service locations for the residents of Ventura County, it would total about 60 different locations between all of those different services. Our medical center, I think, is notable in our county for a couple of things. One is that we're one of two trauma centers, and Los Robles Hospital is the trauma center for the east end of the county, and Ventura County Medical Center is the center for the west side of the county. We also have the only pediatric intensive care unit here in the county of Ventura, and the oldest neonatal intensive care unit. And we do have a UCLA training program for family physicians in our hospital and clinic system, and it's actually the largest family medicine residency in the state of California, with excellent young doctors that come to us for training, many of whom stay and work in our clinic system. Santa Paula, as you know, is a community of about 30,000 people, and we have a rural hospital there that was originally a private hospital that went bankrupt, and the county was able to reopen that now over 5 years ago. Our Conejo Valley Family Medical Group is directed and run by Dr. Paulo Carvalho, and he came with me to the prior visit. He's actually in Portugal right now, which is where his home is, his origin, and so he's visiting with family. But as you recall, the site that we developed was the Borders site here in Thousand Oaks, and this slide shows you the front of the building with the nice sign indicating it's a Ventura County Healthcare Agency site. But probably the thing we're most proud of is that this site is really a multidisciplinary site. And so it does have family medicine services, but also has behavioral health and some public health services as well. I'm going to show you some more pictures and talk a little more about the Conejo Clinic, but just so that everyone knows, we also have opened a clinic in Moore Park. And this clinic is also interesting because its new location on Spring Road in Moore Park is combined with other community-based organizations. So actually, Catholic Charities, First Five, the Human Services Agency are all co-located in the same region, in the same building, essentially, and Dr. Ippolito is our medical director. Sierra Vista is our clinic in Thousand Oaks, and was really the prototype clinic for sort of the large footprint that includes medical and psychiatric services under the same roof. And probably many of you know that people who have serious mental illness actually have a shorter lifespan. and on average die about 20 years earlier than those that don't. And some of that has likely got to do with their ability to access medical services, to have people managing and making sure they're getting medications and tests done. And we're trying to break that cycle by doing these integrated service areas where a patient can go in for a psychiatric visit or to see a therapist, but the family physicians, internal medicine doctors are all there, and the person can basically cross over with their provider from one area into the next and get a medical advice or get another appointment and get services. We do, and I was really happy to hear about the Relay for Life, and that's something that the healthcare agency will be happy to be involved in as well. And we do have a mobile mammography van that goes throughout the county. We do this to areas of low-income folks, but we've actually also been approached by employers and have us bring the van to the site of employment so their female employees can have mammography done in a convenient way and be screened for malignancy. Our behavioral health services, and these services are available under the roof of our new clinic here in Thousand Oaks, include youth and family services, so children, school-based programs. We also have transitional aged youth, and basically that's the term that's used for kids when they hit 18 until about 22, 23 years old. They're in that transitional age between childhood and adulthood, and there are special therapists and programs for them. We also have an alcohol and drug services program here in Thousand Oaks that looks at prevention and treatment, as well as handling people who have been fined for driving under the influence. And all of that is here located in the new clinic. The adult mental health services are many. I'm not going to go through the whole list, but I will tell you that we have an older adults program that actually includes field work. And so if a person is not functioning well in their home, we can actually send out medical staff and nursing staff to evaluate them. And we've done a very interesting program combined with the Human Services Agency in which they can come in with social work. We bring the medical part of the program, can actually do an in-home evaluation for seniors that are at risk. And sometimes those seniors are identified by a pharmacy. You know, they haven't gotten their medicines regularly. It could be a family member. It could be a neighbor. And that's, I think, one of the more interesting things that we do. And, of course, our mental health department has what's called a mobile crisis team. And if someone has a relative or a doctor seeing a patient who's suicidal and they feel that person's imminently suicidal, the therapists go to the patient. So you actually can call them, and they'll come to the home, come to the medical office, and do an evaluation, decide whether that person is seriously at risk, and if so, put them on what's called a 5150 hold, and they can be admitted to a hospital for help. And sometimes we do that combined with law enforcement, but the therapists also have the authority to do that. Youth and family services are very interesting. A lot of these are school-based, and so we actually have therapists that are in the local high schools and also do anger management programs. And again, these things that I'm talking to you about are in this new site. And so they're based, we have these spread across the county, but these are services that originally were at the Moody Court site, and Moody Court, that sounded like quartzite, the mineral, but the Moody Court location, and has now been moved in under the same roof with the medical services. Our public health department has a great many services around the county, specifically here in our site in Thousand Oaks. We have the WIC program, which is the Infant, Women's, and Children's program, and that helps with childhood nutrition. And actually, they do evaluations, make sure the kids are healthy, and then can actually give vouchers so that these children can, get food supplementation. And all of those are designated as their healthy foods. And so it's really so they can get more vegetables and other things that help supplement their diets. And you can't use these vouchers to get Coca-Cola. So very important. And, of course, we have field nursing where nurses do come to the home of residents of the Thousand Oaks area and Westlake Village. We have, of course, a public health laboratory and a lot of other public health services. And I'm going to just touch on couple of programs here, and then I'm going to show you some photos. One of the programs we have is called our ACE program, and basically it's a low-income health plan. And the reason I wanted to share that with you is that it's for adults. You have to be a legal resident of the United States to take advantage of this. But if you make under 200% of the federal poverty level, then you're eligible for this program. And so a person that were to apply is screened to see if they qualify for Medi-Cal. And if they don't qualify for Medi-Cal, then they're able to enter this program. And through this program, they can get comprehensive medical services in our system, which will include preventive medical services, primary care doctor visits, specialty surgeries, pharmaceutical supplies, drugs, medications, that we're able to supply them. And we now have got over 11,000 people enrolled in this program alone. And this is something that is considered a bridge to healthcare reform, in that in 2014, these folks will transition into Medi-Cal, and some will be purchasing insurance through the state health insurance exchange that we've heard about. We've provided a lot of services over the course of this program, which is now several years old. We've had over 38,000 primary care visits covered for people in Ventura County, countless operations, chemotherapy, radiation therapy, a whole slew of services with really comprehensive care that the person in this program currently, there's not even a copay, because we don't want a barrier to them receiving medical services. And I also wanted to touch on this our homeless program. Part of the reason I wanted to discuss that is that we a lot of times think of our homeless population as the person pushing a shopping cart, that's living out on the street. But really, homeless people and homelessness has a much broader definition. And I think of my son's a high school teacher at Camarillo High School, and he had one student turn in her homework late, and he said, "Well, why did you turn this in late?" And he said, "Well, we lost our home, and we've been living in our car." And that girl's going to school every day and doing the best she can to keep her life together. That's a homeless person, another face of the homeless. But there's another face, and those are the kids. Your child went out, they went to college, they had a job, they were living independently, and they suddenly end up back on the sofa at mom and dad's house, and they've lost their home. Technically, they are homeless, and so they're eligible for programs. And so one of the things we do in this homeless program is provide people with medical care, which is inclusive of specialty, hospitalization, whatever they would need. But I think some of the other things that are important is they can get housing assistance. They can be eligible for food bank, veterans assistance, and there are a fair number of people that are veterans that are homeless, and we want to reach out to them through you and through the program here to let them know that we can help them. And there's even assistance with job placement. So if somebody has an interest in this, they can go to any one of our local clinics and present themselves and just say, I need some help. I'm in a situation where I don't have my own home, and I'd like to see what I might be eligible for. And they can come to any of our clinics and do that. So I'm going to go ahead and talk to you a little bit more about the clinic. It's a very large space, as I think probably all of you know. And if you were to walk in the front door, to the right of the front door are where the medical services and public health is, and to the left of the front door is where the mental health and mental health services, behavioral health, and also the drug and alcohol program. And we still have the entrance in the front, and there's still the entrance in the back, as it was when there was the borders. And this is the corridor having been remodeled. I'm sorry if it looks a little dark on the screen, but there are, some changes in the flooring so that people can kind of navigate their way to certain areas. And there's signage, as you can see, up at the top, and I'll show you that a little bit more. But it has this very nice feeling because that sort of corridor was preserved. And this would be youth and family services for the behavioral health department. One of the nice things about this type of a physical setting is that if you're going in, it's not as if you're walking into the front door of a psychiatric facility or something. You're just walking into the front of a medical clinic, and if you are going there for mental health services, you just turn left in the hallway instead of right. And I think it helps preserve services and encourages people to go in there because it preserves some of their privacy. This is the signage for the Conejo Valley Family Clinic, and again, this is on the right side of the corridor, and that's internal signage. The drug and alcohol program is toward the back of the building, so that's the back door that you see in this photo. Financial services we have, and the idea of financial services so people can go find out what they can become eligible for. Because if you can apply, now you can apply for Medi-Cal on the internet, which is terrific, and I hope people do take advantage of that. But sometimes navigating your way through the various programs can be complicated, and so we can give some help. We have, this is a typical pod in the medical side of the clinic, and this is the nursing station, and then the open doors that you see are the examination rooms. And all our exam rooms have beautiful, exam tables and wall-mounted devices to look in people's eyes and ears, and we're able to do pap smears and all of the other sort of conventional office services there. We also have procedure rooms so that if something a little more complicated, a biopsy needs to be done, removal of some sort of skin lesion, or certain procedures, particularly some gynecologic procedures, colposcopy, in which the cervix is examined for signs of cancer, can be performed. And this is an example of one of our exam rooms and another nursing station. And we have X-ray at the facility, and the X-ray is very important with regards to supporting urgent care services. And so if a person twists their ankle, thinks they broke their arm, they can go there and get an X-ray done. And part of what we're trying to do as well is we know that emergency room visits are very expensive, and so we have developed urgent cares around the county so that people can get that sort of episodic care when they have an acute problem. But when they go in there for their urgent care visit, we always ask, do you have a regular doctor? Because we want people to get continuity of care and get preventive medical services. So it's not around just what's bothering you that afternoon, but it's about that more comprehensive look at the person's needs. This X-ray unit is a digital X-ray. It's state-of-the-art. We have a computer system that's called a PACS system. But basically, once the X-rays are done, the doctor can see it in his own office. You can go home and pull up somebody's X-ray. You can be in send the person to an orthopedist, and the orthopedist can pull it up on special screens in the orthopedic clinic, even though the X-ray was done 30 miles away. And, that's been a very nice development for us. This is the waiting room. Comfortable seating. One of the things that happens sometimes in waiting rooms is they put in these large comfortable sofas that you need somebody to pull you out of. And so we've tried to be sensitive to that and have furniture in there that's friendly for everyone. And this is especially true as you get older, too. It's just harder to get up. If your bottom ends up lower than your knees, you're in trouble in a seated position. And, of course, friendly staff. So we did start operations. The clinic is open and working right now, the medical half of it, and that opened on, I believe it was the 24th of September, so it's been open for close to a week. The urgent care is open now. We have started with Monday through Friday hours until 7 p.m. For patients or people that might need to walk in, and we'll eventually be advancing that to Saturdays open as well, and then if the community needs it, to Sundays as well, and open 7 days a week with extended hours. So we're really excited to bring these services here to the community, and we hope everybody will be able to take advantage of that. We are moving toward having internal medicine. We have internal medicine physician there now, but beefing that up a little bit more so that it will reflect the needs of the community, because many times this, with regards to the care of the seniors, our family physicians are fantastic, but sometimes you need some additional supplementation. We also have enough space there that we'll actually be able to bring specialists as needed to help support services. So that's it, and if you've got any questions for me, happy to answer them.
May I, Jim?
Sure.
Last month we had one of the administrators for the Adult Protective Services here, and you were talking about your mobile adult unit. What are either some of the legal or societal regulations or restrictions you have to consider, or do you work with Adult Protective Services on these kinds of situations?
We work with Adult Protective Services, and actually the legal authority for that comes through them. And it's a joint project with the District Attorney's Office as well. So it's really, you're linking together at least 3 county agencies to provide this type of a service. And it's done in a case management format so that it's centered on the individual. You know, it's this person, what do they need? And so when we talk about the team going to visit, it's really for an assessment. And so they're going in, they're deciding what that person needs. It's not to necessarily interfere with or take over their care. It's really to identify them. And since we have medical providers in on this as well, they're actually able to call the patient's doctor, you know, and say, you know, this person's I've found these pills, they haven't even been taken. You know, they can do things to coordinate. I think a lot of times you're really talking about the frail elderly, and sometimes, you know, folks that are progressing in dementia but they're not self-aware. I mean, that's one of the things that does happen is that can happen to us, and we're not as aware as we could be to ask for help.
Dr. Gonzalez, I recall that when we first started planning this clinic some time ago, you had mentioned that you're constantly innovating as you develop clinics around the county and so forth. Could you identify what do you think are the most innovative features of this clinic?
Sure. So a couple or 3 different things. One of them is the integration of the mental health services. And, you know, this is the second clinic we open up, and we're continuing to sort of fine-tune that process. But that's been very useful on both sides of the house. The medical doctors having access to therapists has been phenomenal. And also the expertise of the primary care physician in the prescribing of psychiatric medicines increases through that collaboration. So it works very well. The other thing that we're doing there is something that we call clinic visit redesign, and that is a process in which we try to minimize the patient's waiting time. And so that when the person arrives, and really the way the system operates is that the providers, the doctor, the nurses that are going to be working together that day do a huddle in the morning, and they look at the list of people that they're going to be seeing. And so if they know that Mrs. X is coming in at 2 o'clock and is coming for follow-up of a CAT scan, they already go through the chart. Is the CAT scan result in there? In a regular visit, a lot of times the doctor walks in and it may not be there, and it has to be hunted down, and that causes delays in service. And so this type of preparation for the visits is occurring, and it's actually reduced cycle times by about 1/3 to 1/2. And the cycle time being from the time you walk in the front door to when you leave. And a lot of it, too, is putting the patient at the center of the process. So there's less time in a waiting room. You actually go back to the exam room, and everybody comes to you. And so the person's not being ferried around to 3 different locations in the office. And so that's been another area of innovation that we've done in this clinic in particular, in the Conejo Clinic. And that is continuing. We started that in the old site, but that's going to continue and further evolve here. And I think that, and I'll just mention one more, a third that I consider to be innovation, but is probably, maybe it's overstating it, but I think it's innovation, is the work with the community. We planned this. We have meeting rooms that can be used by community-based organization inside this building. We have a multi-purpose room, which you don't find in very many medical facilities, that we'll be able to do classes, maybe exercise classes. And to me, that's taken one step further because, and it happened in the schools. You know, there was a period. My wife is a middle school principal, and there was a time when they started to try to think of themselves as a community resource rather than just a school. And so you saw, you know, sports teams coming in using the school site, doing community lectures, and I think this is kind of us doing somewhat the equivalent.
Doctor, I have a couple of questions about some of the ways people get treatment above and beyond just coming in off the street and indigent. You had mentioned, for instance, that you have the HMO for your county and state employees, that sort of thing. Is there anything similar to that for the general public that actually buy into an insurance that would take advantage of your system?
Right. Not at this time,
Yeah.
but I think that's an important thing to consider. as we move forward.
I also wanted to know, for instance, just as an example, you talked about the homeless situation, or somebody that, well, you used the example of a returning kid. They have a job, maybe, but they can't afford to live elsewhere. If they went in under that situation, would that be a one-time only thing, or would that be a system set up where they could get preventative? And do you follow my question?
Yes, absolutely.
Okay.
Yeah, it's a system setup.
Okay.
And so
Like similar to the ACE situation?
exactly, exactly.
Okay. All right.
Yes.
Could you tell us what is the fee scale for services at the clinic? Or how is that decided?
Okay. I can't give you the exact numbers because I don't remember them off the top of my head. But what we have is a fee schedule based upon your income or need. And so, it's sort of the highest level. It's sort of, there are charges, but then there's the Medicare rate is generally kind of set as the ceiling for that, and then it drops down. And so a medical visit for somebody that doesn't have a lot of money can be as little as $15, something along those lines, and then can go up progressively. And we have programs where everything's discounted. If a person doesn't have the income. And, it doesn't have the income. For instance, an MRI could cost $100 or $50. But there's some people that we do the services for that don't have anything, and we do them because they need the service. And so I also want to make it clear that, patients' need for medical care is also factored into those kinds of situations. But I have to say that we're a public supported agency, and we're responsible to all of you. And so it's not free. And that's one of the distinctions is we have some great free clinics here in the East County, the Westminster Clinic and the Conejo Free Clinic, and those are truly free clinics, but these are not free clinics. There is some expectation that even an uninsured person will pay some.
Supposing a person, just a regular person with a regular insurance policy through their employee, if something wants to utilize the urgent care center there and just pay with their Cigna, whatever, Blue Cross card, can that be done also?
Yeah, absolutely. And we actually have private patients that come to see us. Okay. A lot of our doctors are very good, and folks deliberately come to the clinic because that's the doctor that they want to see. And we do have contracts with essentially all of the insurance companies, and a person with any kind of coverage can come to our facilities. They are the county's facilities. They're your facilities, and so nobody is restricted.
Do you have any arrangement with Kaiser?
No, we do see Kaiser patients that come and present to us. I mean, we're not going to turn people away, but then it comes down to, is their Kaiser insurance going to pay for their service, or do they have to pay for it themselves?
You mentioned Medicare, and just reading recently that physicians or clinics or hospitals that are taking Medicare can now be penalized if they have much recidivism. Is that, I mean, it seems like with all the programs you have, that should not be a big problem for you folks. I mean, you seem to, once you get a hold of someone, you sort of know how to handle them as well as follow up on them. Is that the case?
Yeah. The issues around that are really readmissions to the hospital. And so if somebody comes in, and the classic condition that's discussed is congestive heart failure. So a person gets admitted with congestive heart failure and they get readmitted a week later, Medicare won't pay for that second admission. And so if you're a hospital that has a lot of those readmissions, then you're going to have a lot of financial trouble. And what this is about the transition from inpatient care to outpatient care, and we a lot of times call this a warm handoff of care. And so when the person leaves our hospital, we've already arranged for them to go to the clinic. We've made sure that they've got medicines in hand or can get the medicines. And we have for high-risk people that have are very ill, have special nurses, case managers. They'll actually call the person, make sure that they're getting to their doctor visit and all. And so that helps minimize the issue of readmission. It's still going to happen because sometimes it's my mother, has congestive heart failure, and she got readmitted 2 or 3 times until we could finally figure out what she could eat and couldn't eat, and that happens even right under my nose. And so that's going to happen sometimes when cases are really complicated.
We got a question here. Amy? Could you step up to the...
Is that on? Hi, Doctor.
Hello.
Thank you so much for coming to our meeting and enlightening us on this well-needed, much-needed, and sounds like fabulous clinic that's coming to our community. If you don't mind, I just have a couple of quick questions. Sure. Your adult behavioral health clinic, does it take Medicare, or is that simply on a sliding fee scale?
No, it takes Medicare.
Okay, because I'm sure, as you know, it's so difficult to find geriatric, psychiatric care in our community. Right. And piggybacking on that, when you mentioned going and possibly having to 5150, what hospital are you teaming up with?
We have our own psychiatric hospital.
You do?
Yep, in Ventura. And it's called the Hillmont Psychiatric Facility. And so patients are sent there for admission. There are only 2 psychiatric facilities in Ventura County, ours and a private hospital. It's called Vista Del Mar.
It's such a shortage for our seniors.
Yep.
And then on a totally separate note, once you start to fill your clinic with more internists and specialists, is your hope that patients kind of transfer over all of their care so that they're all under the UCLA umbrella?
Right.
Well,
this is a UCLA-affiliated teaching hospital, but it's the Ventura County Medical Center.
Right.
And I think Dr. Donalfo is going to be talking about the UCLA system, so it's a separate system.
Okay. So.
But let me answer your question though. So what we want to do is I think here's what's the important part of medical care, and it becomes more important the more ill you are, is the coordination of care.
Exactly.
And so if a person's under one roof and we're all on the same electronic health record, which
Precisely.
we're in the process of implementing, then it makes it easier to take care of the person. I'm a rheumatologist, and one of the toughest things that happens is that somebody's being taken care of by 3 other doctors. And it's all over the place, and the poor patient has to bring their bag of medications, know what tests they had done to avoid duplication. If they're all in the same system, you do away with a little bit of that because I can go on the computer and know whether you had a blood panel done or what your chest x-ray showed. But if you're in a different medical system, it makes it even harder because then I don't necessarily have access to those records. Someday we will. Someday all those will hopefully speak to each other and we'll be able to access records from all over the state and nation. But right now we're not in that place.
Okay. Thank you for your time.
Sure.
Any other questions? Wow. Well, Doctor, thank you for...
Congratulations on all of
Well, thank you. It's a lot of people. And really, I want to... The thanks really go to all of you for supporting the things that we do, and our board of supervisors, Supervisor Parks, who's here, and also our CEO Mike Powers. And so, thank you so much, and it's always wonderful to come up here and meet with you.
Thank you again.
Thanks.
Well, what the heck? Let's see now. We've had the Boomer Boot Camp thing coming up, which is an incredible event going over this month. We've just learned about the amazing facilities that we're going to have here in Thousand Oaks as far as the Ventura County Health is concerned. What else could we expect? Well, I guess you've heard a little bit about it. We're going to also be blessed with the UCLA medical departments. They're going to set up facilities here. And our next speaker is a product of that. Dr. Matteo Donalfo is a medical director of community offices, Department of Medicine, the UCLA Health System. Now, Dr. Donalfo is an internal medicine and infectious disease specialist, and he spent 32 years doing this, so I think he's probably got a pretty good grasp on it. He recently took the position as the medical director of the community offices for the UCLA Health System, as it is expanding throughout Southern California. Please give a warm welcome to Dr. Matthew Donalfo. Matthew's probably wrong. Dr. Matt?
It's Matteo, and everybody calls me Matt, so that's fine. I will keep my... First of all, I want to thank you all for inviting us here. And I know I speak for David and Robbie. A little closer. I just wanted to thank you all for inviting us here to the Council of Aging. I know I speak for David and Robbie for the warm welcome we've received in the community, and we're very excited about moving UCLA Healthcare into this community, into Westlake, and some of the other places that I'll be discussing. And I just, again, wanted to thank you very much, and thank you for that kind introduction. I'm going to keep my comments brief. I'm going to give an overview of what we're doing and why we're coming into the communities. We're going to be expanding primary care and subspecialty medicine care into various offices. One in Thousand Oaks, which will be on Moody Court, which I'll show you a photo of. We've already opened an office in Westlake Village, and then we will be opening offices in Porter Ranch, Santa Clarita, Calabasas, and also in the South Bay and Beach Cities. And those are well on their way to being established. Let me try the first. Yes. Essentially, our strategy has been that we want to bring UCLA to various communities. These will be our third and fourth medical campuses, distinct campuses. They are not UCLA light. We have a full battery of general internists, family practitioners, as well as subspecialty care that will be in each and every one of these offices. The photo that you see in the upper right-hand column is our Westlake Village office, where we have general internal medicine and a variety of subspecialty services, including endocrinology, rheumatology. And the photo that you see in the right lower-hand corner there is our Westlake Village office on La Venta, 1250 La Venta. The photo that you see on the far left is our office in Thousand Oaks. This is on Moody Court. We have approximately 24,000 square feet there. That office will comprise cardiovascular diagnostic service, dermatological services, including Mohs surgery, and then primary care and specialty care on the second floor. When you speak of UCLA Healthcare, let me see. It's not really advancing. Oh, there it goes. Well, that's not really the one I want. Well, okay. Our strategic goals are essentially to bring UCLA Healthcare to communities and not to bring patients back to Westwood or Santa Monica, where we have our two other campuses. With the exception of tertiary quaternary care, our intent is to admit patients to local hospitals. Obviously, here it will be Los Robles hospitals. Westlake Village will also admit to Los Robles. West Health hospitals will also be within our catchment area, and we'll be admitting there. We will also, when we open our large center in Calabasas, West Hills will probably be the primary hospital that we admit to, but we will have patients in both Los Robles and West Hills. When we move to Porter Ranch, we'll likely use Northridge Hospital in Santa Clarita, Henry Mayo Hospital, and then in the South Bay, Little Company of Mary and Torrance Memorial Hospitals. So this essentially outlines what our overall strategy will be. In each of these offices will be, as I said, primary care, family practice, general internal medicine, and also med peds, which are physicians who've been trained and boarded both in general internal medicine and pediatrics. The UCLA healthcare system is rather large. Even before this expansion, most of you probably already know some of our institutions, obviously the Ronald Reagan UCLA Medical Center in Westwood, the Resnick Neuropsychiatric Hospital at UCLA, the Mattel Children's Hospital at UCLA, and Jules Stein Institute. Then we also have Tiburon House. We have over 100 offices, both hospital-based and non-hospital-based throughout West LA and Santa Monica, and we employ about 1,700 physicians. These are all academic appointments through the School of Medicine. We obviously have Davis Geffen School of Medicine. We have three primary missions. One is teaching, obviously, of physicians, research in all fields, and also our clinical practices. So going to the fourth campuses, again, you have the Westwood Medical Campus, a brand new hospital, and also brand new ophthalmological services there as well that are going to be opening soon. At Santa Monica Medical Campus is also a new hospital, Santa Monica Orthopedic Hospital. In our Northwest campus, which we feel comprises essentially from Santa Clarita to Porter Ranch, to Thousand Oaks, Westlake Village, and to Calabasas. And those are the various photos of some of those other buildings that we'll be using. Westlake Village opened in July. It's become a very busy office. It's probably our smallest office. We have at that building approximately 8,000 square foot of primary and secondary internal medicine care on all the subspecialties there, with the exception of pulmonary. We have a large oncological practice there with chemo infusion as well, and we're taking over more space in that building as well. And I think most of you are probably familiar with that. The second building there is the, it is currently, it was the Baja Fresh corporate headquarters. We've taken over the majority of that, and that again, as I said, is going to be encompassing cardiodiagnostics and dermatological services on the first floor, and then primary care and secondary care and in various internal medicine subspecialties on the second floor. We will also have radiological services, very similar to what Dr. Gonzalez was noting at Ventura, as well as ultrasound in that office. The Calabasas office, I'm going back to Thousand Oaks, I'm sorry, we are scheduled to open in mid-November. And if you invite us back, I'll show you some of the photos of that building as well. The Porter Ranch office is in development currently. We expect to open there in the spring of 2013. And again, it's sort of, it mirrors the other offices in terms of what we will have. We will also have we have, I think, 16,000 square foot of primary and secondary care, and then about 8,000 to 9,000 of oncology across the hall that is being built out as we speak. Calabasas, we bought, the UCs, I should say, bought a building on Agoura Road. You could see it from the freeway. It's a 55,000 square foot building. That will be our center out here. It'll have an urgent care. And the Department of Medicine will take 30,000 square foot of that building. We'll have full diagnostic radiological services there, cardiovascular services there, and 10,000 square feet will be it's parsed out to the oncology department for a large oncological practice there as well. These are the services that we'll be having in these various offices. And as you can say, it's a fairly extensive service matrix. Our plan, and we are certainly going to accomplish this plan, is to bring UCLA Healthcare to these various communities. As I said, primary and secondary care will be totally local. Tertiary and quaternary care, if need be, will be in at Ronald Reagan or Santa Monica. And by that I mean things like bone marrow transplants or extensive brain tumors that really are beyond the scope of what we think should be done in a local hospital. Calabasas, again, this is the layout. You could see this building from the freeway. I think there's a Good Night Inn right next to it. If you see that sign, the building right in front of it, right before it, is our building. And we are in the process now, I think, of starting the architectural drawings and getting bids on building this out. This will be a fairly large project since it's so vast. Porter Ranch, Santa Clarita, the same feel. The upper right is the Porter Ranch, if I can see it from here. The access is very easy. It's right off the freeway. Most of the offices are really fairly close to the freeway, so you can get on and off pretty quickly. The Santa Clarita office is a building that the UCs are in negotiation to buy. It's about 40,000 square feet down the street from Henry Mayo. It's a beautiful building, and it also will pretty much mirror the services we will have at Calabasas, in that it'll be our regional center in that area. I won't touch too much on the South Bay because it's a whole different development. It's a fourth campus, but it'll be similar in terms of the size and the scope. And with that, I'm going to introduce my good friend and colleague, Dr. David Rubin. David is nationally known for geriatric services. He is the division chair of the Department of Geriatrics for the UCLA Medical Center and the David Geffen School of Medicine. He is the Archstone Foundation professor. I have it here. It's so long that it would take me so long to read his various accomplishments, but suffice it to say he is also professor at the David Geffen School of Medicine. He's director of the UCLA Claude D. Pepper Older Americans Independence Center and UCLA Alzheimer and Dementia Care Program. He's a national leader, a wonderful friend, and a tremendous physician, and he's going to talk to you in a more expansive way about geriatric services that we hope to bring out to your community as well. My friend David Rubin.
Okay. So I'm in between Matt and Robbie, and you could think of me as a Reuben sandwich here. So I'm a geriatrician. I would say my youngest patient is about 68. My oldest is 100 and a half, and we'll talk a few moments about my patients, but I'm delighted to be here. I'm also a baby boomer. We can talk about that at some point as well. So maybe this works. Yeah, that's the one I'm working on. Oops. Oops. There we go. All right. So we're going to talk a little bit about the Division of Geriatrics at UCLA. Then we'll talk about our patients and their needs, the clinical care we provide, and then the future, particularly how it relates to this area here. So this is actually part of our family. We have about 22 geriatricians, and those are physicians who are caring for older people. That's all we do. We also have 4 nurse practitioners who are in our practice as well, and they're all smiling because they're all very happy. Geriatricians are a rare breed, but in fact, we really love what we do. So who are our patients? First of all, let me just pause for a second and go back to something that Andrew was referring to about the baby boomers. So currently in the United States, there's about 35, 36 million, 37 million older people, 65 years of age or older, which translates into about 1 out of every 8, about 12.5%. By the time we reach 2030, which isn't that far off, there'll be about 70 million older Americans. 70 million baby boomers are coming through. Some of us will die, but that's what the anticipation is. And instead of being 1 out of every 8, or 12.5%, it'll be about 20%, or 1 out of every 5. Now, those are numbers. That's all there are numbers. Has anybody here ever been to Florida? Are there a lot of old people in Florida? Yeah. So 18% of the population of Florida is 65 years of age or older. So what that means is by 2030, the entire country is going to look like Florida, except older. So that's what we're dealing with. So who are our patients? Let me back on the slides. There we go. The first are people who are not sick, who may or may not be sick. Excuse me, they're not sick and may or may not have chronic diseases. So this is Jack Bishan, and I don't think you can read the T-shirt, he says, but it says Jack Bishan, 91 years old. And he was a pretty familiar character in Santa Monica who used to do these 10K races at 91 years old. And he looks good, and you guys can't see it very well. There's some skin damage there from living in Southern California, but nice-looking legs. And this guy is still doing 10K races at 91 years old. And that's where I want to be. We have a motto that a geriatrician's goal, our job, is to have all of our patients die at the age of 90 after having been shot by a jealous lover. That's our goal. Unfortunately, this is not usual aging. This is kind of exceptional aging, but it's within our grasp. This is one of my patients. This is actually a woman named Ann Moore. And this is Ann when she was 86 years old. And she was in the entertainment business her whole life. She was a kind of a valet to a famous jazz singer in the 1950s. So she kind of, and she had a little stuff herself, and she used to like to do these shows at the senior centers. And here she is at 86 years old, and she looks great too. Nice legs at 86. And I have another picture of her at 93. She's no longer alive, But let me just tell you, Ann Moore had a lot of health problems. She had hypertension. About half of older Americans have hypertension, arthritis. She didn't have much of that, but about half have arthritis. Heart disease, about a third, including about a fifth, have coronary artery disease, cancer, diabetes, sinusitis, you name it. The older we get, the more chronic diseases we collect. And then there are what we like to have call the geriatric syndromes. And this is my bread and butter. This is our group's bread and butter. These are what we care for. I would say probably a third to a half of my patients have dementia. Delirium, that's when you go in the hospital, you have your surgery, and you wake up on Venus. You've seen this happen before, yeah. Urinary incontinence, about a third of older women are affected by this, and quite frequently also in older men. Sensory impairment, both visual and hearing. Malnutrition. Sometimes you think of these very frail older people, but actually, curiously enough, the biggest nutritional problem in older people is obesity. The same thing. And not so much here in Thousand Oaks, but you go to the Midwest and you see some amazing things. I hope this isn't being broadcast nationally. Osteoporosis, by the age of 90, a woman has a 1 in 7 chance of fracturing her hips. This is really an epidemic. Falls in mobility, about a third of older people fall each year. Many of these are preventable. Pressure sores, we see very infrequently these days, but we do tend to see them sometimes in the hospital. And polypharmacy. And I'll give you an example. I took care of this VIP patient a number of years ago, and I saw her. She was taking one medicine. And within 3 months of my care of this expert geriatrician, she was taking 13 medicines. She went in atrial fibrillation, she had a little heart attack. All of a sudden, these medicines accumulate. And these medicines are good when they do their job, but sometimes people are on too many of them. And we hear this all the time, see this all the time. So who are our patients? The sick who are functionally impaired or functionally impaired. So these are people who have chronic disease, aren't doing well, like Ann Moore. And this was not one of my patients, but he should be recognizable to everybody in this room. Ronald Reagan. So Ronald Reagan, as everybody knows, in 1994 announced that he had Alzheimer's disease. It was a very courageous act for him to do this. And I did not care for Mr. Reagan, but I know a lot about his health history, and I know a lot about his personal circumstances. And what he did was he basically set up, as he went through this terrible, ravaging disease of Alzheimer's disease, and he went through a lot of it. I mean, he just went through a lot of it, that basically they set up a nursing home in his house. And to do so, he had to sell his farm. He was just like all of us. He was not a wealthy man. And in fact, this is another aspect of aging. And finally, those who are at the end of life. So where do our patients receive this care? They receive it in the community, either at home or as an outpatient, or assisted living, or community CCRIs like University Village. They receive it in the hospital. They receive it in the nursing home. And this is a little diagram, and it's complicated for a reason, because where we receive care as older people is complicated. So in that big circle, it's kind of like a rectangle, more rectangular, is in the community. And you have those three populations: the not sick, the people who are sick and functional impairment, multiple chronic diseases, and the end of life. And generally, that's a one-way street. And then you see people bouncing in and out of the hospital and going to nursing homes, and then back into the community, and then back to the hospital, and back to the nursing home. And plus, there are specific diseases that they have: depression, dementia, and diabetes. Just as examples, there are many more of those chronic diseases that need specialized care. So the point of this matter is it's a complicated system as you get older. You're getting care for different kinds of problems and in different sites. So now I'll beat on my chest a little bit and talk about what we provide at UCLA, because I am exceptionally proud of the UCLA geriatrics program. We've always been ranked very well, but that really doesn't mean anything to me. Rankings are just numbers. It's the kind of care we provide that really means a lot to me. So our primary and our original location was in Westwood. And in Westwood, we have geriatricians there all the time. Anytime the clinics are open, we see patients. We had about 16,000 visits in the last year. And we also run a consultation service at the Ronald Reagan Medical Center and the Neuropsychiatric Hospital. So we don't provide primary care, but we do see patients there. And over the past, 8 or 9 years, we've also opened up services at Santa Monica. We also provide services 10 days a week, 10 sessions a week. That's where I see my patients there. That's where I was on Monday afternoon, seeing patients all afternoon. And we have about 4,000 visits per year in that office. It's a little smaller. And then we have something that's really interesting. It's modeled something we're very proud of. We have a special geriatrics unit at Santa Monica Hospital that has only older people on it, and all of the nurses and all of the therapists and the social worker and the case manager and the dietitian all have interest in older people. And every day on that inpatient service, we have interdisciplinary rounds. We all get together and we talk about every patient. So it is really a model unit. And I have to brag a little bit. We just got new artwork on the unit, and my 93-year-old sculptor put in the artwork. It was her artwork. We also provide care in nursing homes. So we go to 7 different nursing homes. We provide both post-acute care after you go to the hospital. Probably about a third of our patients, a third to almost a half of our patients, when they go in the hospital on our inpatient service, they can't go directly home. They have to go for rehab at a nursing facility, and they see our physicians. So the way I like to describe it to patients is that when you enter our practice, a UCLA geriatrician, somebody in our practice, will follow you to a graveside and beyond. I'm honest with you, that we very frequently will go to our patients' funerals. I can't tell you how many funerals I've gone to. We will send condolence cards. We call people up. And many times they're children. Tonight I have to go back to Westwood because we're having a patient and family advisory committee meeting. And some of the people who are in this committee are the children of patients of ours who have died in the practice. We also provide palliative care, both inpatient and outpatient, at Westwood and at the Santa Monica Hospital. So the future. What we hope to do is exactly what Matt was talking about, is we're trying to take a world-class program and extend it to our new areas where UCLA is going to be providing services. So the initial services, and I've got a meeting with my boss next week about trying to recruit a couple of geriatricians. We have people in mind already who would actually come out here, be based here, do some outpatient care, probably some nursing home care, and probably assisted living or CCRI care. And then eventually that whole model where we care for you from the time you join our practice to graveside and beyond, that's what we'd like to see. That's going to take a while. But this community certainly can support it in terms of there are enough older people here, and there are other need. And let me just say we have a training program. Matt was talking about the educational mission. We have a training program that graduates about a dozen geriatricians a year. So we do have a pipeline, and they're all looking for work. So with that, I think my last slide, and I'm going to turn it over to Robbie Gluckson, who I just met today, but she's certainly on the ball. She's been helping organize this visit. She's oversees marketing and community outreach for the expansion of the UCLA health system. And I was reading over her bio, and there's always things that strike you about people's bios. One of the things was that she went to Bowdoin College, which anybody knows is a great liberal arts school in Maine. It's very similar geography to here. And the other thing is that she's a passionate advocate for patients' rights. And I think that's one of the things you're going to find about the UCLA health system. In our health system, patients come first. So, Robbie?
Thank you so much.
Thank you.
Okay. Your presentation left me speechless. I'm a sandwich in many ways because I'm taking care of a 91-year-old father and a 79-year-old mother-in-law who lives with me. So I feel a lot of the issues that you brought up are so relevant to so many of us boomers, and I'm also a boomer. So thank you for that. That was wonderful. Okay, time to put the glasses on. And if you could pull up the PowerPoint for me, that would be great. I'm assuming it's, which one am I going to press, Matt? Okay, great. Which one am I pressing? Right here. Okay, got it. Okay, great. All right, well, welcome everybody, and thank you for this extraordinary opportunity. I love Thousand Oaks. I wish I bought property here about 25 years ago, but I am very familiar with the community because I drive up the 101 every single day taking my daughter to school out here, so it's a wonderful community. And the best part of my job is that I get to meet people like you, this amazing council, the community residents, every single day. We want to be partners in the community. So over the last year, here's just a small example of some of the organizations that I have been working with. Really just, I feel like it's a giant onion in Thousand Oaks, and you have to slowly peel away the skin because there are so many wonderful programs. We've met with the city manager, we've met with the head of Parks and Recs, we've met with Cal Lutheran, the farmers market. It's endless, the amount of opportunities, and of course the senior center, which I'm hoping to have a meeting with in the next couple of weeks. But these are just an example of some of the organizations we want to partner with and we want to work with. I wanted to list actually some of the folks that I've already met with and we've had relationships with in terms of connecting. The cancer support community, because oncology is really sort of my background, is a wonderful place out here in the Conejo Valley, and we're going to be working with them, and our oncologists will be in the community giving presentations, bringing all the amazing information about clinical trials that UCLA has, and that's very near and dear to my heart. I am a soccer mom besides everything else and did sit on the board of AYSO. And go soccer moms, go hockey moms, go football moms, because you've got a lot of moms out here driving a lot of people. And the sports programs here are outstanding, and we're going to be working with many of them. There's a picture there of the promenade. We have a lot of programs out here in places like the Oaks and the Lakes and the promenade. And part of my job is to make sure that we're out in the community. And many seniors in this area spend a lot of time in those facilities. There's walking programs, there's education programs, and so these are just a sample of some of the places that I hope we will be involved with. And of course, if you have any recommendations, if there's any organizations out there that I haven't put on the screen yet, please let me know. That would be wonderful. Let's not forget our corporate wellness partners. They're very important out here because they fund a lot of programs, and also because it's a great way for us to reach employees with things like, he mentioned, Dr. Gonzalez mentioned the mobile mammograms, but there's many things that we would like to do working with community corporate partners, including lunch and learn programs, where all of our wonderful physicians are available to meet, and a whole series of programs in the corporate setting as well. So what are we doing to keep it local? We're hiring people, and that's one of the first questions I get. Actually, the first question I get is, are you part of UCLA? And the answer to that is yes. And second, are we going to be hiring within the community? And we are. We really have a commitment to that, whether it's advertising in the local Acorn, or recruitment fairs, or when there's open enrollment, which is, of course, coming up right now. We want to hire from the community. And as Dr. Donalfo mentioned, we do want to work with all the community hospitals. There have been a lot of questions about that, but the answer to that is absolutely yes. Education is everything to the UCLA health system, starting with the David Geffen School of Medicine, and all of our physicians have appointments at the medical school. But there's a lot of educational programs at UCLA that haven't even been mentioned yet that we want to bring out here. Obviously, Dr. Rubin, who outlined some of them, there's others, and I'm hoping to meet with the organizations that are senior forward in their thinking to bring some of those programs, and there's just a few examples of them right there. And the Thousand Oaks Senior Adult Master Plan, which I have read cover to cover, and it is yes by my bedside, is a remarkable piece of work. The most remarkable thing about it is that it was done by volunteers. And if you want something done, you go to a busy person, you go to a volunteer. And so you have done so much work to make our lives actually easier with the 5 teams, and I've met them, and I have to say that we hope to get involved and be a big part of your senior adult master plan. There's information in terms of all of our contacts. I have all my business cards out here for anyone who would like them. And if no one can remember that, you can remember uclahealth.org/Conejo Valley. This is what we stand for. We really look for a lifetime of good health, starting at birth and all the way through a lifetime, basically. And if you can't remember the website, you can remember 855-GO-TO-UCLA. And we do have a wonderful call center just for this area, just for the Conejo Valley, and we will answer the phone. And another question I get a lot as well, is it going to take 3 months to get an appointment in Thousand Oaks? And the answer, of course, is no. It will take just a day or two. Same thing in Westlake Village. You can call today and get the appointment. We are staffed and we're ready to go. And again, we hope that the Thousand Oaks facility will hit the mark of opening late November, I think is what we've heard. Again, we wait for the real estate team to deliver us a hard date. But everything looks great. We've been out there every single week trying not to interfere with the construction team, but it looks like everything's going to be great. And you will see our sign, hopefully, from the freeway right off of between Rancho and Moore Park. Thank you. Can we go back to that last slide for 1 second? I just wanted to close with, I really do read that plan a lot because it's very important to me. And I thought it would be important to pull one quote. I don't know, since everybody here has developed the plan, but this was my favorite one. The city can benefit from healthcare partnerships where a preventive medicine education-based system will help to keep our senior community healthy, keep our health care costs down, and provide for more discretionary income. That's from your plan. Your team wrote this, and we hope we will be a partner of yours for a lifetime. We will be here for a very long time. Thank you.
Well, go Bruins. Are there any statements or questions? I would like to ask one very quick question, because I never hear this. Is there any thought underway from any of the health facilities or clinics about dental care? Is that part of the county at all? Do they?
Yeah, it's, well.
Wait.
Yeah, dental services. What we do is for children do fluoride treatments in the primary care offices, and currently it's underrepresented and not a part of our county's medical system at this point. It's something that we've dabbled in a little bit and are looking into, but there is a tremendous pent-up need for this.
Yes, it is.
And one of our local partners, Clinicas del Camino Real, does offer dental services, and so I think if we were to do that, we'd probably do it in concert with them, or at least to complement the services that they're already providing.
Okay, thank you.
Oh, I've got my own. Never mind. I spoke with Robbie about this already, but you mentioned whether you would be hiring locally, and they did hire the dermatologist that I have been seeing out here for 20 years, and she is dynamite. I mean, just wonderful. So if this is an example of, and you took the whole practice, so I'm absolutely thrilled, and she's thrilled. Her staff is thrilled. And that is hiring locally. She has been working out here for at least 20 years. So Dr. Pakula, yes,
Dr.
wonderful.
Pakula. Is this
Thank
on?
you.
Yes, and we can't get that schedule ready fast enough because everybody's calling. So just a couple more weeks and we'll be ready to go. Okay, thank you.
I hope I don't have to listen to a 10 clap when I call into UCLA. But Dr. Rubin, I didn't realize you had such a large geriatric staff facility, whatever it was. You must be doing some research, so is there anything that we should know about at this point, or any other keys that this audience would like to hear?
So I was only allowed to speak about the clinical mission, but we also have a research mission. And several of the faculty are really focused on healthy aging and what can be done to age successfully. some very interesting things. We have one of our faculty members who is working on something that it's called the Experience Corps. I don't know if anybody's ever heard of it. It is something that's being done in Baltimore, where older people are going in as volunteers to schools. And they've just finished this study, and it's showing a lot of positive benefits, and we're working on trying to actually replicate that in the Southern California area. So there are a number of kinds of research in terms of staying healthy and as we age, and being more like Jack Bishon than the other three.
That sort of goes along with our attitude towards volunteering. You volunteer, it's better for you. Thank you, Dr. Rubin.
I have a couple of questions. Seniors not only want to stay alive, but they want to stay active. And will either of these facilities be bringing pain management to the Conejo Valley? And the second question is, will either of these facilities be bringing more teaching and research to the Conejo Valley?
We will be definitely bringing teaching. That's part of our mission. We'll have medical students to begin with, and probably residents and obviously fellows as we expand the offices. Pain management right now is not in this first phase. My sense is that probably when Calabasas opens, we will have pain management there. That discussion has been going on, and we will certainly try to meet that need.
Well, with regards to pain management, I think what we see in our community are primarily anesthesiology-based practices that tend to be procedure-oriented. And so I think, and actually Dr. Donalfo and I are going to sit down and have a meeting and look at ways that we could collaborate, because I think, pain management, particularly, sort of the chronic management of the person and not just procedure-oriented, would be a good addition.
Dr. Rubin, do you have any timeline for when you expect to be able to expand into the Conejo Valley as a geriatrician?
So there are a couple of things. As I said, we have at least people who we have interest in. We've spoken with a little bit. The first thing we have to do is kind of get approval for hiring them, and I think that's going to happen very, very shortly. And then the biggest delay tends to be credentialing. Credentialing takes generally 4 to 5 months.
You've got the location, but not the staff program?
We have to hire. We're hiring some additional geriatricians for one of whom former fellow. Well, actually, both were former fellows, and one of whom worked at UCLA, worked with us in our group, and she has a young child at home, and she couldn't do the community work. So she's dying to get back to UCLA, and so this is perfect for her. So the idea, I would, being optimistically, I would say in the spring. Some always things that can be road bumps, but I think we can have a presence in the spring.
Thank you.
May I, Jim? Sure. Dr. Rubin, again, where do you find geriatricians? I mean, are these folks who have been experienced in the medical and then want to do something different?
We find them on ships, and we kind of sandbag them and bring them in. So they are not easy to find. Less than 1 out of every graduate medical student class goes into geriatrics every year. They're really very rare for people to go into geriatrics. It's one of the least paid specialties. It's high touch, not high tech type of specialty. The good news is that there are some people who it really rings their chimes, like me and my partners. We wouldn't give this up for anything. We just really like it. And every year we have a fellowship class that has about a dozen people, and we have one of the largest fellowships in the world, in fact. And so what we've been able to do is to take the best of our fellows and recruit them into our practice, and that's the model we would be using. Occasionally, we'll bring somebody from outside, but mostly we train them here at UCLA and then put them into the practice.
As you know, Doctor, depression is a major problem with the elderly. What are your plans to?
So, all the physicians here are kind of smiling because we know how difficult that is. Most of the geriatricians, including myself, I would say we handle 90% of the depression we see. It's uncommon for us to need to refer to a geriatric psychiatrist because that's part of our training. And that's actually one of the things I like about geriatrics. I can manage the psychiatric and the dementia almost always myself. So in a sense, by bringing geriatricians, it will help. The other thing is, and I'll have to admit that the geriatrics, the psychiatric services have been a little bit pokier in terms of getting out into the community and along these practices. But it will happen. It will happen. It just has to happen. If UCLA is going to be a health system that goes up the Conejo Valley and down to the beach cities, it's got to be the full services. It will happen.
Actually, I'm going to just make a comment around geriatrics in that it is difficult to recruit geriatrics, physicians that are trained in geriatrics. But I think one of the other things that's important to realize is they generally need to be a part of a big system. And it's hard to really, as Dr. Rubin said, tend to be lower paid. It's hard to open up a private office as a single doctor and try and practice geriatrics because of the amount of time devoted to the touch part of medicine. And so you'll see that in a system like the UCLA system. You'll see that in a system, of our size, that we're able to do that.
So you expect to be able to open a geriatric division? So you expect to have a geriatrics department in your clinic?
Yeah, we have done the inroads that we can in terms of addressing geriatrics, but we have, at this point, one geriatrician in our system, and we need to get a couple more. And really, the geriatric physician will do direct patient care, but in our particular case, will also help develop programs and guide the care that other primary care physicians do. And so it won't be that every elderly person has their own personal geriatrician, but rather will potentiate and improve the quality of the care through the use of the geriatrician as really a resource for the whole system. That's what we do now, but I can see us expanding those services.
Any other questions? Well, I want to thank all of you, and this will be a formal invite back for November. We would love to hear your update and some pictures and all of that, so I'll be in touch with Robbie to work that out with you guys. So let's give a great big hand to Dr. Gonzalez and the UCLA. David?
Yeah, the Conejo is certainly fortunate to have such wonderful system in place or coming to place, so thank you. All right, so much for item 5. Item 6 is the commission reports, and we have Fraud. Marty, you got a few words for us?
Get close to your mic, Mark.
Well, it's hard to believe, but the holiday season is coming upon us. And that brings the gift card scam to light again, once more time. Sorry. Yeah. Okay. Well, we all buy gift cards. They're easy to buy, easy to use, and it's nice to be able to send it to someone who's not really living nearby. But there is a scam that's been going on for a long time, and here's how it works. The thief goes into the store with a pencil and paper and writes down the number on all the gift cards, as many as he can possibly do, and then he goes home. And he calls the company to find out, he says, what's the balance on this card? They say, oh, that card doesn't exist. Oh, so he'll keep going and doing this over again. One day he'll get an answer that says, oh, there's $100 on this card, and then he'll use it because he's got the number. He'll order things online and just collect them all. A more high-tech version of that, he actually goes into the store with a scanner, and he goes and scans that little barcode that's on the back of the gift card. Gets a lot more cards that way. A more modern technique, which is much harder to do, but it's much more lucrative and easy for him to handle. A lot of cards are packed in envelopes, sometimes even a nice, pretty plastic case that makes them more attractive. What they do is they take out of the store maybe 10, 20 of these cards. And, it's easy to take out of the store. Nobody watches them. After all, they're not really worth anything until they're activated. He puts them in two piles, one here, one here, and he carefully removes the card from the case. He takes the cards from this pile and puts them into the case that's in the other pile, and he keeps the rest that's left over. And he puts these back on the shelf or the rack where they were from. And you go out and you buy that card, and you send it in, and you take it up to the cashier. The cashier scans the barcode, puts onto it, let's say $100, whatever it is you decide you want to give to your favorite nephew. And then you take it home, and you mail it to whoever you want to mail it to. But the actual card is in the hands of the thief. The one you sent out is not will not be the actual card. And this particular scam sometimes is never uncovered. After all, you give this thing to your favorite grandson or granddaughter, and they get the card, and they take it, and they go take it to the store, and they try to use it, and they say, oh, this card's never been activated. Oh, he says, gee, awfully nice of Grandma to give me this card. I guess she must be losing it because she forgot to activate it. I won't embarrass her by asking her about it or telling her about it. And so that scam will never be uncovered, because he's not going to tell her, and she'll never know that he never got the gift. Meanwhile, the scammer is running away with it. So, there's not much you can really do about that except a few. So let me give you a few things that maybe you can do. First of all, never buy a card from some back of the store rack or middle of the store rack. Always buy a card directly from the cashier or from a rack that is right next to the cashier. That'll kind of prevent anybody from stealing the number. And the only other thing you can really do is save the receipt that you got. The receipt has a number on it which corresponds to the number on the card, and sometimes you can trace what happened to it. Not always. I had that happen to me. I traced the card that got stolen. It was used in Burbank. And, you always hope that when someone uses the card, the card doesn't come out. You give somebody a $100 card. He goes out and spends maybe $120. You're hoping that he'll take his own card and use that for the extra $20. But they're pretty smart. Whoever this was did not do that. He used cash, so he could not be traced. So it's one of the most lucrative scams around because they hardly ever get caught.
Thank you, Marty. It just never ceases to amaze me. Moving on to item 7, liaison reports. Len, Vice Chairman Len, please take it.
Yes, thank you. We're going to defer item 7A until next time. And so, Andrea, that puts you up to let us know what's going on with all the wonderful things over there at the Goebel Senior Adult Center.
We have lots of good stuff going on. Betty Berry's doing her Medicare 2013 What's New, so she's all over Ventura County. And the one for our center, which is coming up this Friday, is already full. So if anybody's still interested, she's got some in Simi, Westlake, and Moore Park. So they would have to call those centers directly to see if there's any of those. There'll be more coming up, but for October right now, just for what's new, is full for us. Our Wee Bowlers are going to the tournament next week on October 11th, and they've been practicing real hard, so go our Wee Bowlers. Biotech chemical companies, what are they putting into our food? So there's going to be a whole seminar on that, and that'll be Thursday, October 11th at 6:30. The whole park district is doing Bark in the Park, and so that'll be Saturday, October 13th. That's at the dog park up by Waverly on Avenida de las Flores, and they're going to have Tillman and friends and Norman the scooter dog. So if you have dogs, go have fun. It's a whole family thing. There's going to be dog contests, and I'm sure there's going to be lots of different vendors and whatnot out there. So check that out, Bark in the Park, from 10 to 2. And then coming up Sunday, October 14th, which is just a couple weeks away, we'll be doing our garage sale. So we have our community-wide garage sale in our parking lot. Right now we have about 44 different people who have already put in, so it's like coming to see 44 garage sales in one spot. So it's a great place to come shop and find new stuff that you might want. Or I think we do still have some spots left if you would like to sell your stuff there. So, and it's only $20 a spot, and the money does go towards our nonprofit commission to help support the center. Hearing aid choices and new technology, Monday, October 15th. So we have Dr. Taryn Hurwitz coming, explain the new technologies and helpful information on how to choose hearing aids and everything that's out there. If you play table tennis, we're doing our table tennis tournament coming up October 24th. And we have a holiday craft bazaar on November 3rd. So if you're a crafty person and want to sell, I think there might be a table or two left. And if not, come shop. So you got a couple you can make money by doing the garage sale if you want to sell your stuff, and then you can come to the craft bazaar and buy some presents. And we also have besides the Medicare 2013 What's New, we have a Medicare one-stop shop. So that's for those who are new to Medicare to help them select their Part D prescription drug coverage and anything else like that. But they do suggest you attend a Medicare 2013 seminar in order to participate. But if there's any questions about any of that Medicare stuff, though, please call our Senior Concern Advocates, and that number is 805-495-6250. They are located at the Goebel Center, but they have their own separate number, and they do their own separate thing. So those are some of the fun programs coming up. We do have new trips as well, since holidays are around the corner. We have Christmas Is, so that'll be round trip to Motor Coach, to Tam O'Shanter's, and then the Hall Performing Arts Center. Newport Harbor Parade of Lights in December, and Christmas in Laughlin, the Riverside. That's always a very popular one. So all those will be going on sale Friday, October 12th. So that's next Friday. And we still have some room left for Wheel of Fortune with lunch at the Overland Cafe, and that's Thursday, November 15th. That's only $72. So you're getting a bus and you're getting lunch and you get to see Wheel of Fortune. And Rose Parade. It's $151, but you do get the round trip motor coach, so you don't have to drive. You don't have to spend the night on the street like you did when we were younger. And you get to sit in the grandstands right down there on Colorado Boulevard. So, I mean, you're right there. So if that's something you haven't done for a while, that's a really good one to do. And just to let everybody know, I know I brought it up last time, I don't want you to forget that we've got some extra sports programs. So if you're 50 and older and you're not working, or you've got these time frames, Tuesdays is basketball at 8:30, Wednesday is badminton at 11:30, and then Thursday is pickleball at 8:30, and those are all at Borchard Park in the gym over in Newberry Park, and they're free. So it's 50 plus, and they've started. People are slowly trickling, but don't forget to go there. We also have a new stock market boot camp. Boot camps everywhere now. Anyhow, that's going to be coming up on October 31st. It's a 4-week class. It's free. So come learn the ins and outs of buying, selling, trading stocks, and making some sound investments. So just need to call the Goebel Center to get a seating spot so we don't outgrow the room. And then in November, we're going to have a real special one on Social Security. So watch our flyers and our newsletter for that one. And any other questions for the Goebel Center, you would just call 805-381-2744.
Yes, I'd like a quick question, if I may. On this garage sale, you say that's the 14th?
Mm-hmm.
Will there be any food, drink, anything like that
yes,
available?
there'll be some food and drink just for you, Jim.
Thank you very much.
Yes, if you're there early in the morning shopping, you can get some coffee, and I'm not sure if they're doing croissants or if they're doing bagels, but there is going to be something to munch on that's breakfasty. And then they'll be doing some lunch stuff and some sodas, so there'll be
Will
some
there be
hot
some
dogs.
early morning things for the vendors that are actually setting up, and
Or
coffee,
you know,
donuts,
if you
that sort of
get
thing?
there at 8 o'clock and our weather cools down, you might want coffee. You can buy a cup of coffee.
Right, and I would also like to comment on the Betty Berry thing. She's going everywhere and all that, but she will be doing our program on the first Wednesday of November, so she'll be doing a complete seminar on the Medicare thing as well, in case you don't see some of these individual places that she goes.
Any other questions?
Andrea,
Yes?
thank you as always.
Oh, you're welcome.
You sure know how to keep us seniors moving.
We're busy.
Atta
Come
girl.
see us. You can also check out our website, too. So that's www.crpd and then do a backslash and go GSAC.
Very good.
Yes,
All right.
sir.
Oh, sorry, Dixon, yes?
I have a question. Is this garage sale, is that strictly for stuff out of your garage, or if you were a ceramic maker, you can sell the ceramics there? Or for jewelry maker, you can sell the jewelry there?
Okay, he's asking if he's a ceramic maker or makes jewelry, can he do this at the garage sale? No, this is strictly garage sale. But you might want to call the center and see if we still have a spot for the craft fair. That would be perfect for the crafts fair in November, the holiday craft fair.
No, I have other items, but I just want my question.
Okay, thank you.
You can say it was in your garage.
That's right. I mean, you made it in your garage. Hell. I would, but I'm not handy.
Well, what happened one year is we had somebody who made jewelry and then is a clothes distributor and all this other stuff, and that's just really not fair to the other people that are doing a true garage sale. So we keep it to garage sale. Now, if you had odds and end items, yeah, of pottery stuff, but if you're actually making it and it's cool stuff, yeah, it's
All
more
right.
appropriate other spots.
Thank you for keeping us inside the box, Andrea. Thank you.
I'm sorry.
All right, that'll complete that part. We're moving on to item 8. What did I miss? Uh-oh.
I spoke fast.
Well, RSVP is collecting box tops for education. These are the things that are found in grocery stores and items such as Pillsbury, Ziploc, Hefty, and Betty Crocker, and also Campbell soup labels for education, which benefit the Conejo Valley Unified Elementary Schools. Simply clip out the box top labels and save your Campbell soup labels. The soup labels have to be complete, in other words, the entire label, not just a portion of it. Especially has to have the UPC code attached. Then bring them to the RSVP office, and they donate them to the schools, and they receive cool free stuff. The other thing I want to remind you of, November 5th through to November the 16th, the RSVP Boutique Holiday Sale. Don't miss out. You'll find beautiful gifts, holiday items, beautiful handmade specialty articles, and of course, our delightful 50-cent greeting cards. Proceeds from the RSVP Boutique Fund Lifeline services for local seniors in need. That's from November the 5th to November 16th from 9 a.m. to 3 p.m. at the Goebel Senior Adult Center. And
I just want to add that that is a really cool thing,
That is
November
a-
5th
that
to
is
the
a cool
16th. The prices are phenomenal. I've seen there's some really cute things. that they have for sale that they've been pulling out. A few things are out, but I saw a bunch of boxes. There's some really neat items to decorate or give to kids or just things that general nice little presents. So definitely come on down. And there's some beautiful Afghans and things in there right now too. So come shop because that's a really good time because it goes quick.
All right, thank you, Marty. Thank you, Len. We're on to item 8. This is the last portion of our meeting where commissioners can provide any information, comment, or announcement which no action by the commission will be taken. At this time, are there any commissioner comments?
I've got one.
Fire when ready, Len.
This is a shout out to all of the caregivers in Los Robles Hospital. You have under your care a good friend of ours, Elise Klussman, who has been with you for the last 10 days. We know that given her personality, you have been through a complete Medicare audit. You have been told what you may save and what you may throw away. But do take care of her because she's given so much to the Conejo Valley, and we want her to keep on doing that.
I just want to do a quick shout out. Happy birthday, Jeannie Lynn. You're everything to me.
Anything else? All right, before we knock this session in the head, I got a couple of things. I want to, on behalf of the Council on Aging, thank all of you and for being here with us, coming to our reception, listening to the speakers and asking some very pertinent questions and helping us better understand what's going on in the Conejo. Thank you. We threw a lot of things at you. So I'd just like to go over them again, just some of the dates. One thing we didn't talk about is our report to the City Council. The Council on Aging will, on a yearly basis, come to the City Council and describe what we have done and what we plan to do. As you can gather, the SAMP is a big part of it, and the SAMP team leaders will be there describing what they have done and what they plan to do also as part of the overall effort on SAMP. We certainly invite you to come to that. It's going to be on the 23rd, a couple of weeks, 3 weeks from yesterday, and we'd love to have you there. If not, please watch. It'll give you an idea what we're working on, and the doors are always open to our SAMP teams. They're always looking for energetic people who want to add to the quality of life of the Conejo. Boomer Boot Camp, Boomer Boot Camp, the first session is October 17th, and even if some of... 10th, excuse me, the first one, the 10th, that's right, thank you. The 10th, 17th, and 24th? Okay. Again, if some of you folks of our age may not come there, there may be someone in your life who would like to learn about things that we've done, either for better or for worse, and hopefully be able to do better in the future. So please come. Tickets are available. Contact us. We may have ways of helping get tickets. If you only can come to one, let us know, and we may be able to help work something out. There's the street fair that is held on Moore Park Boulevard on the 21st. We're going to be there. We're going to have a booth. The reason we're going to be there is that as part of our art outreach program, we want to hear from folks about what we could do better, what we should be looking at, and just to be able to hear some of the issues that are on your mind as a senior. So that's the 21st all day, and certainly love to see you there and just say hello. We're so happy that Nancy's here, and we do wish her husband Tom, who just went through an angioplast this morning or just before she got here. So I'm so glad she got here, and do wish Tom the best on a very prompt mend. Good luck, Tom. And this day is a very special day to me. It's an anniversary for Corky and me, number 42. And thank you for sticking with me through so many years, Cork. You've been a wonderful partner. Thank you. Anything else, gang? If not, I declare this meeting adjourned.